In this slide deck, we'll talk about Chapter 2, Reproduction. We'll talk a little bit about the background of why we do what we do. We'll have an anatomy review, and then we'll go into the menstrual cycle, and we'll end it on menopause. You want to look at Chapter 1 of F.A. Davis and just review your nursing roles, your standards of practice, ethical considerations, evidence-based practice, client rights, cultural practices, health disparities, which we do have in maternal and infant health. Those background core concepts are part of the why of, why we do what we do, especially why we do what we do in maternal child health. We're going to look at the numbers of maternal morbidity and mortality in our country, and then we'll also talk a little bit about the Delaware statistics. So for maternal mortality, which is deaths, again, just to go back, it's a pregnancy-related death of a woman during pregnancy or within 1 year of the end of pregnancy. So leading causes as of 2020, according to the CDC, are cardiovascular conditions, infections or sepsis, cardiomyopathy, hemorrhage, cerebral vascular incident or accidents, hypertensive disorders of pregnancy, which we talk about in this class. Reasons for infant mortality are birth defects, preterm birth and low birth weight, maternal pregnancy complications, sudden infant death syndrome, and injuries. So it's interesting to me, there's a staggering difference between states. So Mississippi has 8.3 per 1,000 live births of infant mortality. New Hampshire has 3.8. So even in our United States of America, we're very different statewise. And then you can look at the Delaware Health and Social Services website, and you can look and figure out or look at Delaware statistics for both maternal and infant mortality. And it's important to look at maternal and infant mortality because for many communities, it's an overall indicator of the general health of the community. So that's a little bit about why, why do we have to learn NUR 201? Why is it part of a nursing curriculum? So for anatomy review, the uterus is 3 layers. The uterus is right here, this little sort of fist-shaped organ. The cervix is a lower narrow tube at the end of the uterus, so this is what dilates right here when we talk about, I'm 3 centimeters dilated, I'm 4 centimeters dilated. So the neck of the uterus, or the opening, that is called the cervix, and that's what's actually opening up, stretching out, shortening to allow for a fetus to enter and exit through the vaginal canal. The fallopian tubes are at the medial ends. They open into the uterus. The outer end encloses the ovary, and fertilization usually occurs in the outer 1/3 of the tube. Ovaries are located on each side of the uterus, behind and below the fallopian tubes. So for an external review, we have the mons pubis up here. We have the vulva, which sort of encompasses all of this area right here, the labia majora and minora, the clitoris, the vestibule of the vagina, which is basically that opening, the urethral meatus, Skene's and Bartholin's glands for lubrication during sexual intercourse and also for childbirth, the hymen, and then the perineum right here. It's important just to have this review because a lot of when we get into labor and delivery and we get into repairs or complications that can happen after delivery, you want to know, the anatomy of what you're talking about and what you're looking at. For internal, we have the vagina, which is a tubular organ. It's approximately 4 inches in length, and that internally extends between the uterus and the perineal opening. So the pelvis, it's important to know the types: gynecoid, android, anthropoid, and platypoid. So in addition to the uterus, the cervix, the vagina, the fetus is also maneuvering through the maternal pelvis when labor and delivery happens. So we'll talk a little bit about that in person, and I'll show you an in-person rendition of the pelvis so you can get a better idea. But this view right here, this video, I think shows a good depiction of the fetus trying to go through the pelvis and through the uterus, the cervix, and finally out the vagina. So breast, the mammary glands, they're accessory organs of the reproductive system. They're glandular. You'll want to know about nipples, areola, their primary function. We don't go too far into lactation in slides. There is a slide that you have to look at on your own in Module 2. There's chapters in ATI that you'll have to look at on your own, and then we do have the Tiny Hood website that you'll want to look at. That helps a lot with breastfeeding education, what you need to know as a women's health nurse in labor and delivery to assist with breastfeeding and any breastfeeding complications. So the menstrual cycle and reproduction obviously is, the most important part of this class because we need it to happen. Menstruation and ovulation are controlled by positive and negative feedback systems associated with hormones. So you'll need to know and understand the hormones that are released by the hypothalamus, the pituitary, and the ovaries, specifically follicle stimulating hormone, luteinizing hormone, estrogen, and progesterone. So we have hormones of reproduction, and then we have hormones, placental hormones that sort of take over once a pregnancy happens, that we'll talk about in our slide deck tomorrow. So the hypothalamus stimulates the anterior pituitary gland to produce gonadotropins, and those gonadotropins are follicle stimulating hormone, which is FSH, and luteinizing hormone, which is LH. Men and women both have both. Follicle stimulating hormone, obviously for women, stimulates the follicles or the egg follicles to get produced. The luteinizing hormone is excuse me, more responsible for ovulation and maintaining the lining of the uterus in the second half of the menstrual cycle. So here you'll see we have this you have menstruation, you have the follicular phase, you have ovulation right at sort of the middle or day 14 after menstruation, and then the luteal phase. So all of this is happening simultaneously. Every month a woman has her period. Basically the body is, the brain says, okay, we're going to stimulate the body to make the follicles, and then we're going to release the follicle. If the follicle isn't, if the ovum isn't fertilized, everything sort of goes down, everything sheds again, and everything starts again the next month. So tomorrow we'll talk about, if at ovulation there is actual fertilization, where we go from there. But for this slide deck, we're basically just talking about what needs to happen each month to even have pregnancy sort of on the radar. So at the sort of middle age now, there's a natural cessation of menses, or the natural cessation of the menstrual cycle. The years before that, the 10 or so years before that, is called perimenopause, and that's the period that's associated with declining fertility. So, when women are born, there's a finite amount of eggs or ovum that they are born with. In each ovum that matures, it's released. If it's not fertilized, it's just shed with the uterine lining. If it is fertilized, then you have a pregnancy. So around middle age, this gradually decreases, and women greatly have decreased amounts of that endogenous estrogen, which is sort of helping those follicles to mature. So what they might see is vasomotor instabilities. That's why women get hot flashes or night sweats. You might see atrophy of the urogenital sites, like vaginal dryness, urinary disturbances can happen, amenorrhea or irregular cycles. And then there's also hair, skin, and psychological changes. Menopause is actually diagnosed after there's 1 year without a menstrual period. So perimenopause is those years leading up when you might have irregular periods, you might have symptoms, you might not be ovulating every month. Menopause is when you actually don't have a menstrual cycle for 12 months. And then postmenopause, estrogen is solely produced by the adrenal glands. Hormone therapy is an option for some women. There's estrogen only or estrogen and progestin therapy, and that is decided on an individual basis with the woman's healthcare provider. So hormones of female reproduction, again, that you'll need to know. You'll need to know about follicle stimulating hormone, where it's secreted, and what its job is. You'll need to know about luteinizing hormone, where it's secreted, and again, what its job is. So if you can think about, FSH and LH sort of go along with estrogen and progesterone. FSH is sort of that first 14 days of the period. Everybody's getting ready. Everybody's, the ovaries, the body is sort of getting ready to produce and to ovulate. LH, excuse me, is responsible for that ovulation and then maintaining the uterine lining to try to maintain a pregnancy should there be one. And then you'll need to know about estrogen and progesterone. And again, the follicles of the ovaries are where estrogen comes from, on a normal day. The placenta takes over during pregnancy and produces estrogen once a pregnancy has happened. Again, the ovary or the corpus luteum, which is that little bit of leftover follicle once this sort of follicle breaks out after ovulation, that is where progesterone comes from. Again, the placenta produces it during pregnancy. We'll talk a little bit about inhibin and relaxin, but for the most part, these are the four that you need to know, and you need to know where they're secreted and what their functions are in a normal female reproduction.